most people come in two categories. There's someone who's calling because they're in distress. Something is wrong, they need help. It's broken, it's painful, it's whatever it is. So that's a fire that has to be put out. And most of the time what we do in that situation is, we try to figure out what's causing that problem. We'll address that problem. We'll make sure the patient understands the context of this treatment is to relieve them of pain or disease or whatever the crisis is and put that fire out. And then we have them come back and try to get them to be a regular patient, not just someone who shows up because they have a fire that's got to be put out. We want to make sure that we identify any little smoldering embers before they turn into fires. And so if they choose to do that, which most of them do at some point, they'll come in and we'll schedule them in hygiene, and we'll get all of the records. We have to have at least a baseline radiographic record. We don't push x-rays on everybody every time they come in. Some people really have a problem with that. We're not like that, but there is a certain standard that we have to meet in order to be compliant and follow the rules and to do a good job with what we do. So we get our radiographs, and we chart the gum health specifically because the bacteria that cause periodontal disease or gum disease are associated with so many general health conditions, Alzheimer's and heart disease and all sorts of things. So we want to know if people are healthy from that point of view. Do they have chronic disease? And then we just look for things that are wrong and let them know, hey, listen, this is what we see. If I'm going to sequence it, worst first, this is how I would recommend we work through it. And then we just do, what they want to do, pretty much. That's how we do it.